you have children that need to be vaccinated, please review the program qualifications before making an appointment. There's a great link for how to use ECE. ECE is the Colorado Immunization Information System, and it's a ECE directors that are using that are just saying it's so easy to look up, review, and then print immunization records. And that's really helpful when you fulfill the annual requirement of reporting immunization data. And that reporting will open October 1st and then closes January 15th. So please use those links if that would be helpful. Our second question is, and feel free to put the answer in the chat if you'd like, what percentage of infectious diseases are caused by dirty hands? Do you think it's 2%, 30%, 50%, 80%, or 100%? You can take yourself off mute or put it in the chat. I think people might be surprised how effective hand washing is. They say that I got this data from the National Foundation for Infectious Disease, and they say 80% of infectious diseases are spread by dirty hands. So if everyone routinely washed their hands, we could save approximately 1 million lives around the world. And so as I'm going around to ECEs doing inspections, I'm just so happy to see you're all singing the ABC songs, the happy birthday songs, so that soap and water, you're scrubbing the germs down the drain. So keep up the good work with that. Okay, today we'll be focusing on the updated infectious disease manual. It's now a website. When we get to that, Sining will be putting the new link in the chat. So if you have it bookmarked, you'll want to make sure you bookmark this new link. Kyla and Jane and I are your inspectors, and so we always like to give one partnering for success tip, and today is sanitation. Sining will be taking it away about communicable disease updates, talking about measles, West Nile virus, and tick-borne disease. And I'll be talking about vaccine of the quarter, pertussis, also known as whooping cough. And then I saw Amy and Serena on the call, and they will be giving updates from ECC, BC, and CCAP. So I answer your health and outbreak questions, and then Sining is there too. She'll give a wave. And so if you write to us at the Health ECE at bouldercounty.gov, we can help you try to prevent the spread of any diseases in your childcare facility. So first of all, the new CDPHE Infectious Disease Manual is now a website. So if you click on the link that you had, and actually I had the old link bookmarked, you will get a view that looks like this one with the yellow in the center. And what you want to see, you'll see the one on the right is the new website. It's called Infectious Diseases in Childcare and School Settings. You'll see a picture of those cute children there. And then you see the pink arrow is where you can look up the diseases. And this is really helpful with explaining to parents and your staff about what symptoms to look for, what the exclusion would be, and how you can prevent the spread of diseases. So thank you, Sining, for putting that in the chat. I've shared this before, but I think especially since we're starting a new school year, Sining and I created, kind of based on your request, something to report illnesses quicker. And we've timed it and looked at how much time it takes for you all to fill out, and it's less than 3 minutes. And so it's called our illness report form. And so if you notice a few more kids are getting sick with common symptoms, just fill out that form and we can help you figure out ways to prevent the spread. And the info to have, you probably all have this already in your head, but it's important to have info about the number of children enrolled, number of classrooms, number of ill children, number of ill staff, and any children that are hospitalized, their date of birth and name. So thank you so much for using that form. Okay, partnering for successful health inspections. So, what was the most common critical violation in childcare in 2024? You can see here, 37% was 10E. 10E is sanitizers. And then the next one at 21% was 10F, which is disinfectants. So, how many steps are involved in sanitizing? Dun, dun, dun. It's actually 3. So the 3 steps of sanitizing are wash, rinse, and sanitize. And it's been great to go around this year. I think we got the stickers from CDPHE last year, and Kyla, Jane, and I have been handing them out when we go to facilities to have these stickers. So thank you for using them, and please reach out to us if you need some more stickers. And I think the glue on the back of the stickers is really strong, so they've been staying on the bottles well. But of these 3 steps, which step is the most forgotten? The most forgotten step, which we have found, is the rinse step. And there's 2 different methods that we've been seeing ECEs use the 3 steps with the detergent, rinse, and sanitizer using buckets. The rinse step is important because for 2 reasons. One, you need to read the manufacturer's directions for your sanitizers, and it will say to clean, rinse, and then sanitize, especially the bleach solution if you use that. And if there's even just a little bit of soap on a toy or on a tablecloth, then your sanitizer is less effective. So we want to make sure that you're doing all that hard work with the 3 steps, that you make sure that you rinse so your sanitizer works as effectively as possible to kill any germs. Other facilities are using the spray bottle method, again with the 3 steps. And the labels that we provide follow the regulations, because all of your labels need to have the content and the purpose of each, whatever is in that bottle. So if you can see the sanitizer, step 3, you know the sanitizers for food contact surfaces, tables, and toys, versus a disinfectant, which is used for toileting and diapering, and if a child vomited. Okay, so then when you're mixing your bleach, how do you know if the bleach solution is too high or too low? You just smell it and then you know? No. It's important that you have test strips available to test it. And the chlorine solution should be between 50 and 200 parts per million. And that you should test the sanitizing solution every day. I was at a facility in the last 3 months, and they mix their bleach on Wednesdays. And I was there on a Friday, and we tested the bleach, and it was between 10 to 25 parts per million. Because bleach will go to the bottom, and so you'd really need to mix the bleach, and just over time, bleach is less effective. So that's why it's important that you test your solution daily. And if you notice if it's really dark black, that means it might be over 200 parts per million, and that's what's used for disinfecting. And then these are just 2 handy resources as well. The daily refrigeration temperature log. I've seen people using that in the kitchen, which is wonderful, but I'm also encouraging people to use it in the infant room, in the small kind of dorm size refrigerators that are used to store bottles for infants. So, and it's important to look at that daily to make sure that the temperature is 41 degrees Fahrenheit or below. Okay, well, Sining will take it away with mosquito and tick-borne illness. Thank you, Sining.
Thanks, Martha. Can you hear me okay?
Perfect. I can.
Okay. Awesome. Alrighty, well, will be talking to you guys today about mosquito and tick-borne illness and then doing some measles updates, because I know that there are probably some questions about what's going on with measles, since we haven't been hearing a lot about it in the news recently. All right, Martha, you can go on to the next slide. All right, so I'm going to talk a little bit about West Nile virus. It is a virus that is transmitted through the bite of mosquito. It's our leading mosquito-borne illness in Colorado, so that's why I'm talking about it today. And most people who test positive or have been exposed to West Nile virus have mild symptoms or no symptoms at all. So really, it's something that's underreported in the state of Colorado. We don't know the true impact of how many people are actually getting West Nile virus. And most of the people that are reported to us are having neuroinvasive disease. So it results in things like meningitis or meningoencephalitis and things like that. This often causes hospitalizations. This is mainly in people older than 60 years of age, so not really the populations that you all are working with, but it can still impact individuals younger than that. With like febrile illness and things like that. For those that are most susceptible to disease, it can cause, like I said, inflammation of the brain. So that's that meningitis and or spinal cord. And then about 1 in 10 individuals with severe illness die. Next slide. West Nile virus was introduced to Colorado in 2003. So that's when we were seeing our first cases and when we started really tracking it from a public health perspective. Our case season is typically around June through September. We did start seeing cases around the end of June to early July this year. And we are starting to see an increase in cases now here in Boulder County, and I'll talk about that a little bit in the next couple of slides. The Colorado cases account for about 26% of US cases. So if you think about what Colorado's population accounts for in the US, it's about 1.6% of the population. So it's a significant amount of cases in the US that Colorado accounts for. And then in 2023, we had our worst year since the introduction of West Nile virus. It was really like off the charts. We haven't seen anything even close to that, or especially since then. And about 60% of those cases that year had neuroinvasive disease. Again, remembering that people who don't have symptoms or have mild symptoms, those individuals aren't being counted in those case counts because they aren't necessarily going to the hospital, they're not going to a doctor, and they're not testing positive for West Nile virus. Kyla had a question about any theories on why it's so prevalent in Colorado. Yeah, so one of the biggest things is that the mosquitoes that carry West Nile virus, it's one of the Culex mosquitoes. I don't remember the specific mosquito or a specific species on the top of my head. I'm not an entomologist, but I believe it's Culex tarsalis. Culex tarsalis is found in Colorado. It's not seen in a lot of other states, so that's why we see it so prevalent in Colorado. So we have mosquitoes that carry it. It's why we don't see other mosquito-borne illnesses. So right, like if you're thinking about malaria or chikungunya and things like that, we don't have those mosquitoes that carry those illnesses in Colorado, but we do have mosquitoes that carry West Nile. The other thing too is likely due to environmental factors. We have a population that spends a lot of time outdoors, in the wilderness, in places where there's water, pools of water, things like that. So I think that that's why we see so many cases in Colorado as well. But great question, Kyla. Um, Back to 2023. So those high numbers were likely due to a wet spring season, which we are seeing this year as well. So we're predicting that cases are going to be maybe not quite as high as 2023, but still a significant amount this year compared to previous years. I'm going to skip this last bullet point. You're free to read it on your own, but Martha, you can go to the next slide. This is a graph showing you what West Nile looks like year by year in the last 5 years. The way that we look at incidents typically, or when we should be concerned, like there's like a red flag, is we look at a 5-year average. So we're looking at the previous 5 years. Obviously our data from 2020 and 2021 might be a little bit skewed just because it was the years of COVID. And people were spending more time indoors, so there's likely less chance that people were exposed to mosquitoes. So that might be a little bit skewed, but you can see in 2023 that year we had a huge amount of total QLEX mosquitoes that year. So that definitely throws off our 5-year average. Our 2025 numbers are looking okay, but keep in mind that we're only about like 2 months, 3 months into mosquito season at this point. So that number is only going to climb, and I would predict that it's going to surpass 2024. So it's likely going to be around, I would presume, around the levels of 2022. Keeping in mind that we've had a wet spring and summer, it's continuing to rain still, so there's still areas with standing water where mosquitoes can breed, and it has been warmer this year as well. Let's see. As of August 9th, we've had 5 cases of West Nile in Boulder County, so that's not incredibly high yet. That being said, there are a number of cases that have been ruled out, so people still test positive, but we rule them out on our end due to a lack of symptoms or other reasons. We have a case definition that it doesn't quite fit or something like that. There have been 38 cases that have been reported in Colorado this year, and this is just as of like the last few weeks we've seen this West Nile virus cases start to creep up. We have had 1 death in Boulder County as well this year due to West Nile virus and several hospitalizations. So you can see Martha has shared the link, or Kyla has, or Kyla shared a link, I think, from Boulder about West Nile prevention, but Martha can share a link with our mosquito pool data. So that'll give you a better idea of how many mosquitoes we're seeing currently, and then the number of QLEX mosquitoes, which are the ones that carry West Nile virus. Next slide, please. Okay. And then how do I prevent West Nile virus? I know that you all have kiddos that go outside. The short answer is you can take a few different steps to prevent the exposure to mosquitoes. Reducing exposure to mosquitoes is going to be the best way to reduce exposure to West Nile virus. So there are the 4 Ds. So the first D is to defend, so to wear an EPA approved repellent, and I can have Martha drop that link, or I guess Kyla's doing it. Kyla dropped the link into the chat for you all. The next thing is to wear closed-toed shoes, wear light colors. Mosquitoes tend to be attracted to darker color clothing, and to wear long, loose sleeves and pants to prevent mosquito bites. Draining things that may hold rainwater or other water is also very helpful in preventing mosquito breeding, because mosquitoes like to lay their eggs in bodies of water. So draining any like buckets, or sometimes people have like old tires in their backyards that might collect water. So those can be mosquito breeding sites as well. And then the last thing is at dusk and dawn to limit your outside activity. This is when mosquitoes are most active, when you're most likely to get bit. So that's another good way of preventing exposure to mosquitoes during West Nile virus season. Next slide. I'm going to go over some tick-borne illness in Colorado as well. We have seen, because of rain, because we're seeing more growth, ticks like to live in tall grassy areas. We're seeing more grassy areas, more green this year. We are seeing more ticks in Colorado as well. So we have a few diseases that can be transmitted by ticks in Colorado. The first 3 are transmitted via hard ticks. Those are the ones that are on the left on the slide. Those hard ticks can carry Colorado tick fever, Rocky Mountain spotted fever, and tularemia. And then the soft ticks, the ones on the right, can carry tick-borne relapsing fever. And these ticks are mostly associated with high elevation cabins, so you're not going to really see those soft ticks in the Front Range, but more likely if you have, any properties up in the Western Slope or something like that. Next slide, Martha. This is a really cool program that the state uses, and I'm going to show you some surveillance data that we have from this program on the next slide. But this is a slide from the state. This is called the Citizen Science-Based Surveillance Program. What's really cool is that if you get bit by a tick, you can go ahead and just send it off to our state entomologist, and he will go ahead and identify the type of tick it is. This helps public health determine what ticks are circulating in Colorado and to give us a better idea of what illnesses we might start to look out for in the future. One of the biggest tick-borne illnesses is Lyme disease, and we don't see that in Colorado because we don't have the ticks that carry Lyme in Colorado. But if you are out on a hike and your dog or you get bit by a tick and you pull it off your body, you want to know what kind of tick it is, you want to contribute to public health data, you can go ahead and send it in. And Kyla just dropped the link in the chat for you all for that. Our 2025 tick surveillance, we've had about 200 submissions compared to last year at around 120. So you can see we're getting a lot more ticks sent in. Is that because there's more ticks or there's more people that know about the program? It's hard to say, but we are getting more data, which is great. Our local submissions are either Rocky Mountain wood tick or American dog ticks, which isn't unusual. This is stuff that we see in Colorado quite consistently, as you could have seen on, I think, not the last slide, but the slide previous to that. And then, like I said earlier, we're having a wet winter, we're having wet spring, and it's driving a lot of tick activity. And I think it means spring 2024, not 2023. So yeah, we are having a lot more tick activity this year. So it's just something to look out for if you are seeing, or if you're taking your kiddos outside. Next slide. Prevention for ticks. Biggest thing is stay on the trails. If you're going to be going out and about, don't go into grassy areas. If you are going to, check for ticks. This graph on the infographic on the right gives you a good idea of where to check for ticks. They like to hide like in the back of your knees or under your arms and your armpits. So just like something to look out for. Some places people don't look is inside your belly button. So, but the biggest way to prevent tick exposure is through insect repellent, so any DEET or permethrin, and then proper clothing. Like I mentioned with West Nile, it's the same thing. Long sleeves, long pants. Try not to have too much exposed if you're going to be walking in like tall grassy areas. Next slide. And then another good way to prevent tick-borne disease, if you're bitten by a tick, there's a proper way to remove them. Don't just rip them out. If you don't remove them properly, their little, I don't even know what it's called, but the little part that bites you can stay in your skin. And that's the part that can potentially prevent or can cause illness and cause disease transmission. So if you're removing it properly, the likelihood of you developing or being exposed to any tick-borne illness is quite low. Most of the time, the tick has to be attached for quite a while before that transmission can occur. So if you're able to remove it quickly and remove it properly, the chances of exposure to a tick-borne illness is quite low. Next slide. And we are going into a measles update, so feel free to drop any questions that you have about mosquito or tick-borne illness into the chat. I'll kind of monitor it, but I'm going to jump into a measles update if there aren't any questions. Okay. Martha, next slide, please. All right, to give you an idea of what's going on in the US currently, we're seeing a total of 1,356 cases in the US this year. That is quite high compared to last year. I don't have the numbers in front of me, but usually they are, maybe a tenth or less than a tenth of what our normal case count is. And much of those cases are from international travel, but we are seeing community acquired illness this year. So we're seeing transmission happen in the United States. The age groups that are being most effective are between 5 to ages above 5, basically. But there are a significant proportion of under 5-year-olds being effective as well in the United States. Our individuals that are unvaccinated or have unknown vaccination make up about 92% of that. So you can see that individuals that are vaccinated have much more protection. And then about 13% of cases have been hospitalized due to measles exposure. And then we've seen 3 deaths as well this year. Next slide, please. Here are our Colorado case counts for this year. We haven't seen any new cases in the last couple of months, knock on wood, but as of August 9th, or really as of like July, because we haven't seen any cases recently, we've had a total of 16 cases. One of them was in Boulder, which I'll touch on in the next couple of slides. And then our age group is mainly 18 plus years of age. We've had 4 hospitalizations. I believe that 3 out of the 4 were unvaccinated. And then it is interesting to compare. About 56% of our cases in Colorado are unknown or unvaccinated. So if you compare that to the CDC numbers, it is much lower. This is likely due to we had an outbreak related to a flight. So it was a flight from Istanbul to Denver, which is a long exposure period. And then as well as we just think that, people tend to be more vaccinated in Colorado. So just the number of people that are being exposed and the number of people vaccinated, it's just a higher likelihood that you're going to see vaccinated, or a higher likelihood that you're going to see vaccinated people come back positive. Or maybe the other thing too is that individuals are more likely to seek care here in Colorado as well. All right, next slide. Boulder response for our 1 measles case, and this is to give you guys a good idea of what a response looks like if we were to have a case or when we had a case. But we had 1 confirmed case of measles, and it resulted in over 250 hours of work between our epi team, our immunization team, our comms team, our emergency management team. So it's a large-scale response for 1 individual. About 81 contacts were identified from the 1 person, and that's just in Boulder. That's not even counting exposures that happened outside of the county. We were able to successfully reach 74 of those individuals and give them measles education, do an assessment for risk and things like that. So you can imagine reaching out to 74 people would take a significant amount of time. Unrelated to our Boulder case, we've had 22 suspect measles rule-outs. That number is probably higher now as of the last week since I've updated the slide. But yeah, there's a significant amount of people that are reported to us that might have measles, but we've been able to rule them out. So that takes some time out of our workday as well. And then we held a local tabletop exercise on April 17th with some of our school and ECE partners, which helps us prepare for these situations. We've also attended regional tabletops and workshops for measles preparedness, so we are ready for anything to come up. And really, this last response that we had was really effective. We didn't have any other individuals come back positive. It was really efficient. Our teams worked together really well. It was great. It was, quite an exciting thing to work through in public health. And the last thing is we've ramped up a community outreach to encourage symptom monitoring and vaccination in our community as well. All right, and I think this is my last slide, Martha. But this is just a reminder for you all for what you can do to help us prepare for a measles case. We talked about this, I believe, at the last partner meeting, but I just want to give you all a reminder because we are still looking out for measles exposures, measles cases popping up. We still have people that travel here from out of state that might have been exposed to measles. So even if we're not seeing new cases recently, it doesn't mean that people aren't traveling in and out with potentially exposing some of our community members to measles. So the first thing is to encourage routine vaccinations. Remember that individuals 6 to 11 months old who may not be in the age group to get their first measles vaccine can still consider early vaccination if they plan to travel internationally, especially if they're traveling to areas with measles transmission currently. You can monitor for symptoms, especially for those who have traveled to areas with measles, and then reporting any suspect or confirmed cases to public health immediately helps us a lot. Especially with measles, there is a chance for using post-exposure prophylaxis, so vaccinating so we can prevent the development of measles. That has to be done within 72 hours. So you can imagine that it's a pretty quick turnaround if we have to vaccinate individuals in your facility. Having immunization records up to date for both staff and children is really helpful so that we know individuals that we have to exclude versus individuals that we can keep in class, I suppose, if a measles exposure were to occur. We don't want to take out any staff if we don't need to, right? Ensure that sick policies are encouraged, so make sure people are staying home when they're sick. Maintaining attendance records, that's really important if we want to figure out who's been exposed if there was a measles exposure. Ensuring you have a way to communicate with your parents just in case we need to send out a notification. And then always isolating infants from other classrooms, so minimizing any floaters or staff members that go between classrooms is really important as well. And I think that's pretty much it. If anyone has any questions, feel free to reach out to me. I believe my email is on these slides. Yeah, I think that's all. Thanks so much. Dee Dee has a question about ticks. Are we allowed to remove a tick? They're not allowed to remove a splitter, or should we call the parents right away and notify them at pickup time? Martha, do you have an answer to that?
I don't know, actually. I think Jane's on the call.
Yeah, I might ask your child health consultant. My immediate response would be to similar to a splinter, to call the parent or talk to your nurse.
Perfect. Great question, Dee Dee. Okay, we'll keep putting questions in the chat. We appreciate that. And thank you so much, Xining, for a wonderful overview of West Nile virus, ticks, and measles. And I've noticed when I've done some inspections that you're really good at emptying anything on your playground that could collect water. So at the end of the day, if you have a little dump truck that had water in it, you're really good at turning that over so that there's no place for mosquitoes to breed. So keep up the good work. We have had quite a few questions about outdoor air quality regarding air pollution as well as heat. And the questions are, when can our kids play outside? So I wanted to share these two tools to help inform your decision making. So the Air Quality Index, the AQI, is a great source. And I think Xining will put that in the chat for understanding air pollution levels and the next step to protect the health of the children. And even an orange level you'll see there is considered unhealthy for children. And then Weather Watch, we'll put the link in the chat as well. And I like to look at this because you can type in the zip code, because Boulder County includes ECEs in Longmont, in the city of Boulder, parts of Lafayette, Louisville, one place in Erie. And so you can actually type in your zip code and then you can forecast and look at what days could we go outside and play. There's the environmental rating scale, the ERS tool, that says children can go outside between 20 and 90 degrees Fahrenheit. But note the ERS is a licensing tool, so it's not a regulation. And just thinking about going outside, I think you're all really good to help prevent heat exhaustion by encouraging children to drink plenty of water, wear hats, and wear sunscreen. So those are just two tools for you, the Air Quality Index and the Weather Watch. Okay, we like to feature one vaccine every quarter, and this quarter we're featuring whooping cough or pertussis. And I love to look at these graphs and to look at when was the vaccine introduced and then what happened afterwards. So this is looking at pertussis cases from 1922 to 2023. So you can see here 1922, 2023. And the vaccine for pertussis was introduced in the 1940s. So here you can see the 1940s. It's dropped, 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 dropped. And then since then, the number of cases has decreased more than 90% compared with the pre-vaccine era. So I think it's always important just to keep that in perspective. So pertussis in Boulder County, 53 cases we reported in 2024, 14 cases so far in 2025, and these cases are predominantly among school-age children. So what can you as ECE directors look out for? There's a prolonged uncontrollable cough, and young infants might have a gasping or inability to breathe, or their skin may turn blue. And half of infected infants are hospitalized. So keep an eye out for those pertussis symptoms. Our state childhood nurse consultant, her name is Sarah Lopez. She wanted us to share this with all ECE directors. And I know there's a lot of information on this slide, but Jane will share the whole slide set after the recording is done. And all of these go to links. And so if you have parents who want to fill out a certificate of non-medical exemption for vaccination, there's a new certificate. And so they should fill out the new one every time a child is due for a vaccination based on their age. And then I think you all are probably planning for your professional development for your staff throughout the year. So we thought we would help you out with, here's a free training. The first one is everything you need to know about sanitizing and disinfecting. And there's a link there. And your staff can also receive PDIS continuing education credit. And for if you have cooks or really anybody that works with food, there's the Colorado Food Handlers Card Training, and the cost for that training is $10.99 per person. And then also as you're planning your year for professional development, Kyla's on the call here, and she provides wonderful classes for child care providers based on whatever topic you'd like to learn about or to have your staff learn more about: nutrition and mental health, breastfeeding friendly child care. Now we'd like to have, I think Amy's on, representing Early Childhood Council of Boulder County, one of our two partners. So take it away, Amy.
Thank you. Hello. So I just wanted to share a few updates for UPK, Universal Preschool. As you can see on the slide, there's over 2,000 applications for Boulder County and 62,000 statewide. And you can see the numbers right here. Around Boulder County child care providers, we have 146 participating in UPK, which is 72% engagement. 7 are family child care providers. 90 of those are community-based providers, and 49 are school district sites. If you have any questions about Universal Preschool, there's the email right here, upk@eccboulder.org. Please send your questions to that email address, and Lizette or Sherry Hannah Bennett will answer your questions. And then next, we just wanted to share an opportunity for a pilot program to promote childcare availability and openings. We are partnering with Boulder County Find Help to support providers to share information for families about availability and openings in their programs. And so families can search for your program on the BOCO Find Help link or app, or I'm not sure what it's called. And they will be able to find your program and reach out to you directly if to find care. And so we're doing a pilot program right now and looking for programs who are interested in trying this out. And so there's an interest form. The link is there on this. I don't know if they can click on the slide, but I can put it in the chat if that's helpful. And we have a flyer in English and Spanish that has more information if you're interested in that. And again, just a reminder, on our website, we do have childcare availability information as well. And then our quality support, our 2025 to 2026 quality support grant application period is open. We are still accepting applications. Programs who are rating this coming year are prioritized. It's the Colorado Shines Quality Improvement Grant. So if you are in the process of rating and would like support with coaching and funding, please apply as soon as possible, because it is filling up quickly. After we prioritize those programs that are rating, then we look at other criteria, such as programs that may be rating in the following year, or haven't received any support or been a part of the grant in the last couple years, or geographic distribution. So we really want to support as many programs as we can. So if you are interested or are in the process of that grant, please apply as soon as possible. And then finally, we are starting a new our next course of trauma responsive care for infants and toddlers in childcare. We had one last spring, and now we are I think it was in June. The next one will start the end of September on Monday evenings and Saturday mornings. It's an 18-hour course. That is what the state is requiring now. It used to be 12 hours. So that you will, and it's a great course. It does apply to not just infants and toddlers, but supporting all families and young children who have experienced trauma, and looking at classroom environments, a lot of different areas to support your work with children and families. And registration is opening very, very soon for that. And I think that's all for now.
Yep. Wonderful, Amy.
Should I put those links in the chat with that, or can they click on from here?
You know what? I think since, yeah, Dee Dee said the link is not live, please put them in the chat here, and then people can get them right away. And then they'll be saved in the PDF of the PowerPoint slideshow, which Jane will send out, and they should be live then as well. But then people will have two opportunities. Super. Thank you so much, Amy. You're a busy lady. There's a lot going on at ECCBC.
There is a lot.
And now we have Serena, who's our Boulder County CCAP program specialist.
Hi, everyone. Thank you, Martha, for having me on. My name is Serena Dudge, and I'm the CCAP Business Office Manager for Boulder County. And kind of along the same theme as Amy, to begin with, we're just going to chat a little bit about the UPK stacking funds with CCAP today. So for UPK Universal Preschool, everybody has been asking questions, had a lot of providers, a lot of clients asking. As you know, UPK is for the universal preschool kiddos who get hours, and those sometimes will conflict or parallel with CCAP. And so the state is asking us this year in CCAP to help them stack the funds. And We just got our first batch of data. And so I was going to just give a little bit of background on how this might work. And there's a lot of different meetings through the state for provider support as well. And then I also put a little bit into the newsletter that we're going to be reaching out to providers soon. And it's not going to be starting till about September. But here's sort of the timeline of how it's going to go. So we are being asked to stack. So the funding, there's funding that comes from CCAP for kids and for Universal Preschool for Kids. So when these funds are stacked, the two funding sources, they work together to pay for both, right? But they're not used during overlapping time periods. And you probably were already asked as a childcare provider to start submitting those schedules for the kids to the state for your UPK program, not for CCAP, but UPK. So in phase one, there's a couple phases that go on this year. In phase one for this school year, just starting this week, there'll be a manual process for stacking with limited scope, and I'm going to talk about that. And then there's going to be a second phase next year for next year's school program, and it's going to be more of an automated process. And they're currently the state is currently working with IT for development of the system to do that. So bear with us. This is a manual process, and we're going to just take it slowly, and you'll understand what I mean as I go a little bit further into this presentation. So the manual process with limited scope of dually enrolled children means the limited scope is that children that have 30 hours of UPK and also full-time or more of CCAP hours. So the CCAP and the UPK are at the same provider as well. And so I think you can go to the next slide. And if you have questions that pop up in your mind, feel free to put them in the chat, or we can answer them after I go through sort of this process. So the phase one that's starting this school year is the county references a stacking report. And this, we have the stacking report. We got a preliminary one just last week. And right now the counties are looking through that. They're double checking the data. They're comparing the children. They're looking at the children for 30 hours only, because that's a lot of hours. And the 15-hour children, anything under 30 hours, we're not worrying about stacking funds. It's just kids that have 30 hours for UPK. And then the county is going to reference the UPK schedule with the applicable program. So this is where by 9/1, by September 1st, the providers are submitting their UPK schedules to the state. So then the counties can reference those as we have to do a little bit of math then. So when we get our list, and mid-September is when we're going to finalize the data. So this is when it all really starts to come to fruition in CCAP. We're going to analyze the data. We're going to take those kiddos. We're going to look at your schedule, and the county is going to subtract the UPK daily schedule from the CCAP daily schedule. And I have a little example there. So if the current CCAP off is 10 hours, 6 of those hours are covered by UPK, and the new CCAP off is 4 hours. So, I mean, this is a very basic, I mean, we're looking at kids that have 30 hours of UPK, and CCAP that is like much more full-time. So full-time is 5 hours a day. So it's 25 hours or over for CCAP, right? Because then we would be paying for a lot more care. That's why we want to stack them, because they're not using CCAP and UPK at the same time. So the county sends, what we're going to do in the county is we're going to send a form that's called an attestation form. It's a notice to the family, the client, to confirm their care needs via DocuSign. So this notice will also go to the provider as well once we've confirmed it. Technically, we just need to know, is this really your schedule for CCAP or for UPK and for CCAP? And if so, we're going to decrease your authorization in CCAP. That doesn't mean they are eliminated CCAP. They're not. They just get a decrease in the authorization for those days that they're using UPK. They can still use the full-time care for like spring break or winter break or school days off. It's okay. Some days they're going to need more hours, but some days they won't. So we send that to the family, and the family has 45 days to respond to us in DocuSign. That's why I'm saying this is not a fast process. This is a very slow, conscientious process of being mindful of each family and each provider and how they're all being affected. So, for example, if the client does respond to us within 45 days, says yes, signs off, we're going to connect with the provider and let them know that the authorization is going to be changed appropriately. If they do not respond, what happens to the family if they do not respond to the kiddo's authorization? Nothing. We just leave it as is. The funds will not be stacked, and there's no what do you call that? There's no negative repercussion for the family. They're not going to lose UPK. They're not losing CCAP or anything. It's going to be just status quo, but the funds won't be stacked. Eventually, come next year, there's going to be certain more steps in the automated process and helping them to respond, right? And we will do some reach out within the 45 days as well. Okay, so I think so that was this is my last slide, so thanks for bearing with me here. We do have some frequently asked questions from clients and from providers. If your question is not covered here, feel free to reach out to us. Feel free to put it in the chat. I can always reach out to you as well. So the clients frequently ask questions. Will I lose my CCAP if I have UPK? No, you will not. Not at all. Will I lose my CCAP if I respond to the attestation form? And I know this has been like kind of high anxiety, for families because they don't want to lose their CCAP, and they won't. It's the authorization is just going to be changed to accommodate the funding, the stacking of the funds. You're not going to lose CCAP. So will I lose my CCAP if I don't respond to the attestation form? No, you will not. You will not lose your CCAP. You'll not lose your UPK. We're just trying our hardest to stack the funding so it can be allocated correctly. But we do appreciate if you can encourage your clients to respond to us via the DocuSign. That would be great. That we would really appreciate it so that we can help the state with funding. And as you know, we're all kind of in a tight spot with funding, so we're going to do the best that we can. Now, providers, some questions I've had from providers come through. Will the process start August 1st? No, not necessarily. We did not start right away on that date, right? The funds aren't stacked. There's a lot that goes on behind the scenes. The data is not available at that time. Like, we have sort of a practice run of data that just came through for the first round of kiddos, and then the next round will be available mid-September, and that's when it really starts the process. And I'll be meeting with Sherry with the ECE. We work hand in hand talking about the process, so she's really aware of what's happening. So you can also reach out to them for questions. I'll be meeting with her next week as well, so we can go over the next steps. And this is all based around sort of the UPK payment schedules, which are absolutely very different than CCAP, right? So we're just trying to put those in order to help be the most efficient. So another question, can the children use UPK and CCAP concurrently? Yes, they absolutely can. However, we are definitely trying to stack funds for the limited scope kiddos to the best of our ability, because those are the kids that have a lot of hours. The 30 hours UPK comes first, and then CCAP's used to fill in the blanks, fill in the time. And then we'll change their authorizations, but no, they're not going to lose their program. So what's the process to stack funds? Just kind of went through that. We will be touching base with the providers in a few weeks here to kind of update them. What are the next steps? And I know the state has been putting out a lot of good material as well. Every county will be using the same steps and process. So yeah, we're excited to get this going come mid-September. Okay, so any questions? I think that was it. That was my last slide.
Thank you so much, Serena. Do you mind putting your email address in the chat if
Sure.
people have questions? But I think it sounds like a very thoughtful, slow process, and that you're a specialist and available to guide people. So that's super helpful, Serena.
Absolutely.
Thank you.
You're welcome.
Okay, and if any of you would like to receive professional development certificate, please email us with your first and last name and your facility name to healthece@bouldercounty.gov. And then, as usual, we're always open to your ideas, so please contact us if there's a topic you'd really like for us to cover in our quarterly ECE partner meeting. And our next Health ECE partner meeting will be Monday, November 17th, which is the third Monday of the month from 12 to 1. So thank you so much, everyone, for attending and helping partner with us to prevent the spread of disease, to keep your classrooms open and provide healthy space for your children and teachers to learn and thrive. So thank you so much. If you have any questions, feel free to unmute yourself or ask in the chat. Thank you.